All right, thank you guys. My name is Mobolaji Odewole, and I'm currently the Student Council President. I'm so glad to see all of you guys today. And last year, I was actually a participant in the student panel discussion, and I'm thrilled to be joined with some of our incredible students and my fellow classmates. So I'm gonna give each of them time to introduce themselves, their names, their specialty, and everything else.
Okay, hi everyone. My name is Tka Edwards. I am a student in the DMP FMP program currently about to graduate in 2 weeks, so I'm excited. Um, I'm also working as a registered nurse at NYP on the med-surg unit. Oh, my apologies. It's New York, New York Presbyterian, my apologies.
Good afternoon. Good afternoon. My name is Nia Josiah, and I am a PMH MP DMP nurse here at Columbia University. By trade, I'm a neuropsychiatric travel nurse. I also am a TA here at QSON and at GEC Academy in Shanghai, China, and an RA at Johns Hopkins School of Nursing. Thank you for having me.
First off, thank you guys all for taking the time to listen. I very much appreciate it. My name is Kat Quinn, and I am part of the first doctorate in nurse anesthesiology class. I'm also the vice president of the student council of the SON, and I have 10 years of ICU experience in various specialties, PICU, NICU, and then I've spent the last 6 years in New York as a cardiac ICU nurse at NYP.
Can you all hear me? Is this on? It's on? Okay, hi. Thank you everyone for attending today. My name is Jaspreet Wadhwa. I am currently a student in the DNP Family Nurse Practitioner program. I've got 2 semesters left after this, so wrapping up the program and excited to start working afterwards.
Hi everyone, thank you so much for being here. My name is Katherine South and I am a PhD student about to graduate in a couple of weeks. And I've had a wonderful experience here at Columbia, and my research focuses on healthcare transition for adolescents and young adults with chronic conditions.
Thank you. So I would like to start with the first question. Why did you choose Columbia?
So why Columbia? It all started on visiting day, actually. I experienced some community there. So when I came in, everyone was like mingling, talking, and I was there, I didn't really know anyone. But then persons came up to me, started talking, it got more comfortable speaking with everyone. And those same persons that I met there were actually still friends and colleagues now that I actually talk to when I'm at work and be like, hey, I have a patient, can you help me out? So just the community, the support, that's why I chose Columbia.
Nia, thank you.
I chose Columbia for 3 words. I always say this: innovate, transform, and lead. I think that Columbia has given me a platform matriculating from Johns Hopkins School of Nursing to here as an Ivy League to widen my platform to reach more marginalized populations as we are nestled in the community that surrounds marginalized populations.
Is it working? Oh, great.
Yes.
So we're all nurses. Who of you, as a nurse, has learned from a nurse, has seen a nurse that has a superstitious safety emergency thing that they have in place? You can, don't be shy, raise your hand, that because of an emergency they've encountered. I think all of us have that. I certainly do. And that goes to say that the things that happen to us inform how we practice. And I think the same goes for where you learn. It informs how you practice. And the type of practice that I want to have and will have coming from Columbia is one of excellence, built here in New York City, one of diversity and one of a phenomenal education, learning from only the best professionals and the leaders in my specialty. And so I chose Columbia because it will inform my practice, and I don't just want to be a nurse or nurse anesthetist. I want to be a Columbia nurse anesthetist.
I chose Columbia Nursing. First and foremost, it is a phenomenal school in the best city in the world. And, you know, coming from a small suburb in Southern California, outside the big city, I think it was extra validation of all my hard work and effort prior to coming here, being able to be on the quote-unquote big stage here at such a reputable and well-known school. I think that this, like my colleagues, it gives me a platform to further my reach and you know, just do the best for the communities that we will all work in. I think that's the most important thing.
So prior to deciding that I wanted to go back and get my PhD, which was a huge leap, I had been working as a bedside nurse, and I knew that if I was going to make this change to go back to school, I wanted it to be a good investment in my time and energy. And Columbia has been the best investment because they have been invested in me. And from day one, everyone here, my mentors, the staff, the faculty, has just really believed in me. And I knew that from the very beginning, and coming here 4 years later, sitting here, I know that this has just been the best decision that I've made for my career.
What an excellent answer. Thank you, guys. So moving on to the next question, and I would like to ask each one of you guys, what do you want to do after graduation?
So after graduation, my goal is to actually stay in primary care. I'm now completing my training as a family nurse practitioner, so I wish to gain some more foundation in that aspect. But another thing that I want to do is mentorship. While working as a nurse, during the MDE program, you do have an intensive portion of it. I actually had the opportunity to be a preceptor to one of the MDE students, which is like a full circle. I really enjoyed that. So I think those are two things I want to do when I'm done.
After graduation, I'd like to apply for assistant full-time faculty position at a reputable institution. Within 2 years, I'd like to open my own private practice. And I would also like to land an inpatient psychiatric position as well. So if anyone is hiring, I can, just kidding. And I would like to continue my nursing research and my philanthropic pursuits. Giving back to my community is, you know, paramount to me. And it really does define who I am as, you know, a future advanced nurse practice provider. And it also defines and corporalizes my purpose.
So after graduation, I am going to do what a lot, if not all, Columbia nurses do, which is change, innovate, and lead. I have a particular interest in women and children's health, and I see a lot of opportunities in growth in providing comfort and sedation and anesthesia care, not only for women throughout the gynecological process, regardless of their age, but also interpartum surgeries where you have two patients, a mother and a baby, and you can do operations in a womb. And I think these surgeries are new, they're innovative within the last 10 years, and it is very interesting to me to be in a growing field. And so that is one of the forefronts I would love to be a part of when I graduate.
My aim is to become an oncology nurse practitioner and eventually shift to palliative care later on in my career. Something I'm also, you know, an idea that I'm toying with in my mind is after my parents retire, I hope to work with them in order to help care for migrant communities and those seeking political asylum. Both of my parents are immigrants from Afghanistan, and so I've heard the stories about how, you know, when they moved here in the 80s, there was no one around for them, and they kind of had to do everything for themselves. And so I just want to help give back in that capacity, something that's truly meaningful and deeply seated for me.
So I will be building on the knowledge and skills that I learned in the PhD program here by actually starting a postdoctoral fellowship at Harvard University in the summer in the Pediatric Health Services Research Fellowship. And I'm so excited to take the first step to start building my independent program of research with all of the knowledge and skills that I gained here at Columbia.
Thank you, guys. So moving on to our next question, I would like to ask each and every one of you guys, what has been the most influential thing for you here at the School of Nursing or in your profession?
Most influential thing for me was back in 2020. I guess I was fortunate, or I don't know, but we were that class that was doing their intensive when COVID hit. It was pretty hard, but what we did, or what Columbia Nursing did for us, was to have us immersed into the hospitals to help. So I think that was, sorry.
Take your time.
I think that was one of the most influential parts because of so much that we went through. Sorry. And we learned so much at that point, and that's why that kind of cemented me in wanting to stay in nursing. Sorry.
Thank you.
Sorry.
It's all right. It's all right.
So we were just finishing up our program. Again, it was that 6-week intensive that we were supposed to have, and I had plans to do a global travel, because that was that was the intention for most of us. But then everything got canceled because of COVID. So we had to stay in New York City, and then while we were staying, Columbia was like, yes, we need to have our students help out in some way. And they gave us the opportunity to be in the hospital to help the nurses, and just being exposed to that was it was challenging, but we learned so much during that time. And just to be there, be able to help the patients that were going through so much with this new condition, to see so many people dying, so many families unable to even visit during that time, it was very hard for everyone. But that made me into who I am today. And that allowed me to be more passionate about what I'm doing, and more grateful for where I am right now and being able to just help people in general. So I think that was one of the most influential times here.
Incredible story.
Wow, that's a tear. That's a tearjerker. No, I agree. I mean, that's beautiful. That speaks to what we do every day as nurses, right? So another hand clap for that. That's beautiful. I think for me, I've had a lot of influential moments. But if I could expound on one or two, I would say the flexibility that my program director, Dr. Kelly, has given me to grow my brand and to network with other professionals in my specialty. So over the past 2.5 years, I've gotten the opportunity to present my research at the Sigma Theta Tau National or International Conference in Edinburgh, Scotland, as a DNP student. And that's huge, right? Because I feel like as DNP students, we are so driven to do clinical practice. And sometimes we don't have the time, and some of us don't have the interest to marry the world of nursing research. But that has been one of the things that I have always aspired to do. And I've been grateful to have had the opportunity while I'm here to present my research at Sigma and to publish 4 peer-reviewed nursing articles and also 3 editorials, both in national and international journals of nursing, and to also bring forward my fellow QSON colleagues onto my nursing teams. We are now working on an editorial that is currently been accepted and is in press, where we are addressing the mortality rates that are skyrocketing among Black birthing mothers. And I'm excited to share that and disseminate that this summer. So I think, speaking to what you said about mentorship, peer mentorship and professional mentorship is key. I learned that through the Plan Leadership Program that Dean Wolf spoke on earlier. Just being a light to those around me and to not hoarding information, right? Because when you can spread information freely throughout the universe, that's the beauty of connection. And that is how we as nurses climb the ladder of nursing upward mobility, is pulling, a fellow nursing colleague up as we climb. And so I wouldn't have had that opportunity if I wasn't tribed around encouraging leaders as I do, and have here at QSON. So.
These are so great. Yeah, I feel like we need a round of applause for that. That's amazing. Being at the beginning of my education, it is so inspiring to hear your stories of the things that you have gone through. So thank you guys for sharing. I think for me, because I am in my first year, one experience that has really stood out to me is an anesthesia conference, the first anesthesia conference I ever went to earlier this spring as an advanced practice nurse. And I think that you work very hard and you dream of this moment where you are finally part of this program and you finally get to say, I'm a Columbia nurse. And in that moment, being in that conference, you can probably all agree you have felt that in your specialty where you know you're in the right family reunion. You are surrounded by like-minded people who have great ideas that are going to change the forefront of nursing. And something that I am so proud and humbled that I experienced there is how much respect the Columbia name has throughout the nation. Really, it is, I am so honored to be a part of that, and it was really moving for me to not only know I'm in the right place, know I'm with the right people, but also know that I am learning at the best place for what I'm doing, and that was so meaningful for me.
Well, it's very inspiring to hear what all my colleagues have to say. I don't think that there's been one extremely influential moment rather than as opposed to like an influential time period, right? I started here at Columbia in the MDE program in 2019, which like Tka, was affected by the COVID-19 pandemic. We didn't really get our integration and we were kind of just thrown right into the hospitals right afterwards. Fresh out of nursing school, so really having to keep our head afloat was a tough task for sure. If I had to pick one moment, I would, maybe not a moment per se, but I would say that the things that have been most influential to me are the relationships that I've built with the faculty, the staff, my colleagues. In particular in the MDE program, like we said earlier, Mary Moran, she really helped all of us, myself included. I'm not different than anyone in that regard. And during my DNP program so far, I actually was the president of Men in Nursing a couple of years ago, and Dr. Donald Boyd right here, he guided me along the way through that process and provided, invaluable advice and just like a very comforting figure in my life. But yeah, I will say that that's probably the most influential set of things that I've had during my time at Columbia.
so many wonderful and inspiring stories, and I'm so proud to be sitting up here with all of you all. And I think for me, there's been so many influential moments that have made up my journey here at Columbia. Speaking from the growing nursing scientist perspective, I think for me, my most influential moment was being awarded my first NIH grant as a student. And that was something that I didn't even think would be possible. I didn't even think that I could do it. And my mentors believed in me and the faculty believed in me. And it just really, I think, set the tone for confidence in myself as a growing nurse and researcher. And I think that really did set the tone for the rest of my career.
Thank you. What an incredible stories. So finally, for our last question for each and every one of you. So finish this sentence for me. I'm proud to be a Colombian nursing because, and we'll go down the line.
Okay, I'm proud to be a Columbia nurse because I have the opportunity to help people in their most vulnerable moments. And I have the opportunity to provide holistic care, patient-centered care as well, to all my patients. And just being a part of a global supportive community is also why I'm proud to be a Columbia nurse.
Thank you.
I'm proud to be a Columbia nurse because I stand on the shoulders of nursing giants that paved the way for me today. From Jamaican nurse, Dr. or Mary Jane Seacole, to Guyanese nurse, Daphne Steele, because I am Guyanese American, to Sylvia Whitehead, class of 1958, one of Columbia School of Nursing's first African American graduate. So I am who I am today, and proud to be who I am today because of the mavericks that came before me, to which I stand.
So I am proud to be a Columbia nurse because 0.2, and like for the people in the back, 0.2% of CRNAs in the United States and possibly the world are Native American. And when I graduate, I will increase that statistic. And that is all possible because Columbia University values diversity. They valued the worldview that I had growing up as in a Indian reservation. They valued the diversity that I brought, and in my experiences, I grew up intermittently not having water, not having electricity, not being able to discuss, much less dream of college. And because Columbia took a chance, took an investment in me, I am very proud to be part of this. You know, I'm proud to be part of an institution that creates opportunities for people like me. And not because of my personal gain, but because somebody like me can see what I've done and say, if she can do it, I can do it. And I think the legacy I see here today is the same. You each create a legacy for someone else to look and say, if they can do it, I can too. And that is the true value that Columbia brings, and I am so proud to be a Columbia nurse.
Like I said earlier, I'm extremely proud to be a Columbia nurse because I've forged such great relationships with students, staff, faculty. And, you know, I'm proud to be a part of a community that looks out for one another. That's something that I've felt during my time here. No one really falls through the cracks here. There are layers of safeguards, you know, from students looking out for one another to the faculty that you see on a day-to-day basis. You can work with them as well, and they are always keeping an eye on the students. And then there's the higher level staff that we may not interact with, but they're aware and they're also watching in the background just to make sure that no one falls through the cracks and no one feels as though they're not supported.
I'm proud to be a Columbia nurse because I'm now a member of a global community that is completely committed to advancing nursing science.
Wow. What an incredible panel. Round of applause for them. I think that's all the time we have today. And I would just like to say one last thing. I'm so incredibly proud of each and every one of them. At some point in time, I've been either a classmate or a coworker with each and every one of them. And this is just a testimony of Columbia Nursing. And if anyone is looking for why do I need to invest? Why do I need to donate? You could look at each and every one of them. This is a testimony of the leaders, of the faculty, and the incredible staff that we have at the School of Columbia. Thank you guys very much. Appreciate it.